Hi guys, this is Sean, and I chose to do my project on tracheostomy care. What is a tracheostomy? A surgical procedure called a tracheotomy is performed to create a hole in the front of the neck into the trachea. The tracheostomy or stoma is the hole that is surgically created. The tracheostomy is the air passage that is created so air can be breathed into the lungs when the normal way of breathing has been obstructed for some reason. A tracheostomy tube is inserted into the stoma to provide an airway. This is a picture of the stoma in the airway. Why is a tracheostomy needed? There are many reasons why a tracheostomy is needed. Trachs are performed for reasons related to a blocked airway or the need for ongoing respiratory or ventilator support. Some reasons are birth defects, injuries, major injuries that involve the mouth and nose, an emergency situation where an airway is blocked. This could also result in an emergency tracheotomy, disease, coma, or cancer. Where is the tracheostomy located? During surgery, a hole is created in the neck below the Adam's apple. The tracheostomy tube is then inserted below the vocal cords. This allows the person to talk and allows air to enter through the tube. And this bypasses the mouth, nose, and throat. Tracheostomy care. The tracheostomy must be taken care of daily. There are specific procedures for the cleaning, suctioning, and care of the trach site. This picture shown here is a sterile tracheotomy cleaning kit. It has the 3 compartments for the hydrogen peroxide, the water, and the saline solution. Tracheostomy tubes can differ, but most commonly consist of 3 parts. The outer cannula, which is the outer flange with the neck plate. The inner cannula, that's the actual tube that is inserted into the stoma and locks in place. And then the obturator. This is used to guide the tracheostomy tube in when it's being inserted. It's important to note that when the obturator is blown up and used, that the airway is actually being blocked. So it needs to be a quick process. Tubes can be disposable or reusable. This is a tracheostomy with the neck piece, the guard behind it, and all in place. Cleaning. The process of cleaning the tracheostomy needs to be completed by the caregiver. Materials and all need to be ready, and this is something, again, that has to be done daily. Suctioning. The body creates mucus that can accumulate in the airway. This mucus must be suctioned out to keep the airway open. Suctioning should be completed whenever it is needed. It varies depending on the person. When a tracheostomy is new, often it has more mucus than it normally would, so there's more suctioning in the beginning. There are signs exhibited to let the caregiver know suction is needed. These include loud breathing, the rattling of the chest, attempts to cough, attempts to clear the airway. A person with a trach who's had it for a while may actually request suctioning. There are different types of suction procedures. There can be sterile suctioning, which everything is used one time, or clean suctioning. This is often what is used in the home by the parents or the caregivers. That is a hand washing situation where everything is as clean as with antibacterial soaps. A bulb syringe can also be used for suctioning. Tracheostomy tubes need changed every 28 to 30 days, so once a month. This is done with at least 2 caregivers present. The caregivers are given a lot of training on all the care procedures before the person with the tracheostomy is released from the hospital. Often with patients, they are there for many days, so a lot of practice is done with caregivers. Things to look for. The skin around the stomach can be irritated or infected. There could also be an infection in the trachea. There are some signs to look for when caring for the tracheostomy site. redness of the skin behind the outer cannula, blood when suctioning, changing color or smell of mucus, more mucus than normal or needing to be suctioned more often. Anything that is concerning or out of the ordinary, you need to contact the doctor. Some of it can be taken care of in the doctor's office. Other things may involve surgical removal of extra skin or granulated skin. When in doubt, call the doctor. Daily life, most people with a tracheostomy are able to live a normal life. They go to work, they go to school. If they need therapy after, speech therapy, physical therapy, they're able to talk. If this is their only issue, if the tracheotomy is their only issue, they're able to move on with a semi-normal life. Children with a tracheostomy are able to attend school and participate with their peers. The daily care should be completed at home. However, the school nurse or a teacher or paraprofessional can take care of the cleaning if they are adequately trained. There are accommodations that need to be made in the classroom to ensure the safety of the student. The role of the teacher, the main care of the tracheostomy needs to be done at home by the caregivers, but at the school level, the school nurse should be able to take care of the student's needs. The teacher needs to be trained by a medical professional such as school nurse on care and procedures in case of emergency. And trained on the care for that specific student. Teacher also needs to be aware of safety issues in the classroom. The student does not need to be around dust, sand, glitter, or aerosol sprays. The tracheostomy tube does not filter any of the air. When we breathe, the air is filtered by our nose and mouth and warmed up, and none of that happens through the tracheostomy. So those students can't be around sandboxes where glitter is used for arts and crafts. And teachers need to work closely with the parents, caregivers, and the school nurse to make sure that the students' needs are being met in the classroom. Most students who had a tracheostomy as their main medical issue were found to attend more school after the surgery and the tracheostomy was in place. So there are things that there are educational impacts for the children because they're able to attend more school. And there are things that the teachers and the school has to do to make sure that the child with the tracheostomy is safe while they are at school.